This is an excision biopsy from a 14-year-old male who was complaining of testicular pain, and this is a lesion that had arisen within the Tunica vaginalis, producing a sort of excrescence, and the pre-existing lesion was thought to be a hydrocele. This is an extremely rare lesion, and the problem is nomenclature. So according to the leading urological textbook that I use, it is called a benign papillary mesothelioma, although the WHO in their blue book recommend the term well-differentiated papillary mesothelial tumour because there are so few cases to determine the long-term prognosis due to lack of long-term follow-up, although local excision is curative. These lesions occur in young men and most are associated with a hydrocele. It should be pointed out that malignant mesothelioma can arise in this location, and the average age of men developing it is around 55 years, and in 30 to 40% of cases there will be a history of asbestos exposure. Grossly, there is usually a hydrocele sac with papillary excrescences with solid areas. Histologically, the characteristic feature is papillae. Some are complex, with a single layer of cells that may be cuboidal, columnar, and flattened, and the nuclei tend to be large and bland with minimal mitotic activity. The cytoplasm is eosinophilic, and there are often scattered psammoma bodies, as is typical of so many papillary tumours. So here are some more histological images of the lesion. Here you can see multiple papillae covered by columnar, cuboidal and some flattened cells with abundant pink staining or eosinophilic cytoplasm and regular nuclei. This papilla has a rather more complex structure. And here is an even more complex papilla with multiple micropapillae arising from it. And finally here is a papilla containing multiple psammoma bodies.